Log on to WHBC.com and share your children's Christmas list with Santa, and you could win a virtual visit with the big man himself.
Merry Christmas.
Wrapped up by Hartville Hardware and Lumber, Hartville Kitchen, T-Mobile, Friends and Family Credit Union, and News Talk 1480 WHBC.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our socially distant technical producer, J.D. DeAngelis. Joining Brad and I this morning are our special guest, Tonia Burley, registered nurse, infection prevention and control coordinator, and Kathy Reed, registered nurse, infection prevention and control nurse. Good morning, ladies, and welcome to the show. And also listening in is Becky Fernandez, the famous marketer from Mercy Medical Center.
Thank you, Paul. We're glad to be here today.
And we're glad to have you.
Healthy hands are happy hands, and happy hands make for happy and healthy homes. It's National Handwashing Awareness Week, and never has it been more critical time to focus on the importance of hand hygiene and keeping our hands healthy so that we have healthy homes. Today we're going to talk with Tonia and Kathy and discuss the importance of hand hygiene and the best way to keep our hands clean and healthy. We'd like to remind our listeners that our program is available on our podcast, so you can look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app and subscribe to our show.
So, Tonia, if you're listening, I'm not sure who's listening. Introduce yourself and tell us what you do at Mercy Medical Center.
Sure. So my name is Tonia Burley, and I am a registered nurse, and I do infection prevention here at Mercy Medical Center. Have done infection prevention for about 20 years now and have been at Mercy for over 7 years.
And Kathy, please introduce yourself and tell us what you do at Mercy Medical Center.
Sure. Good morning. My name is
Morning.
Kathy, and I work in infection prevention and control with Tonia. I've been in infection prevention for about 20 years, and but only at Mercy for the last 3. I am certified in infection prevention.
So, tell us a little bit about National Handwashing Awareness Week and why we recognize that, particularly now.
Sure. So National Handwashing Awareness Week was started in 2000 by a family medicine doctor called Dr. Will, and he had small children that he was concerned about the infections that they would get going to daycare and then to school. So he became a hand hygiene awareness advocate, and he actually started this Awareness Week back in 2000, like I said. He also started Henry DeHaan Foundation. If you've heard of that, Henry DeHaan was initially a puppet that he developed to help teach children about the importance of hand hygiene, and Henry DeHaan has actually evolved into sort of an animated cartoon now. So that's how it got started.
When I was a working pharmacist in the stores, I washed my hands probably 20 or 30 times a day. What is so important overall for us to wash our hands many times, I guess, a day or after every event that requires that? So I guess what requires that, you know?
Hand washing is very important. It's the single most important way to prevent the transmission of infections. That's true in a hospital, out in public, in your pharmacy, at home, wherever. Times that you want to wash your hands are anytime you've touched something that is dirty, obviously before you eat, after you go to the restroom, those kinds of times.
Take us through the process of a thorough hand washing. How long should we wash our hands for?
Okay. The whole process should take approximately 20 seconds. Turn on the water. Choose warm water, not hot water. You want to protect your skin. Your skin is your barrier against infections. Lather up, making sure that you scrub all the surfaces of your hands, the back of your hands, the palms, between the fingers, your thumbs, even up on your wrist. Then rinse, holding your hands low, letting the water run off your fingertips. Pat your hands dry with a paper towel. Don't rub. Again, that causes chapping and breaks down the skin. And use another paper towel to turn off the faucet so that you don't recontaminate your hands.
You know, just as an aside note, I have one of the newer Apple Watches that has that feature when you wash your hands, it starts that countdown timer. And you don't realize sometimes how long 20 seconds is. So when you think you're washing your hands effectively, you know, I know sometimes throughout the pandemic, we've read, you know, sing yourself a song that lasts 20 seconds or count to 20 or whatnot. But I think it might surprise people how long 20 seconds really is when you're trying to be intentional washing your hands. So something to think about. Sure. So is it important to completely dry your hands after hand washing? And is it okay to let them air dry?
Either would be okay. You just want to make sure that you don't recontaminate your hands. So make sure you use a clean towel or dry.
All right, so this brings up the important question of towels versus automatic hand air dryers. I know that a lot of bathrooms like to maintain their cleanliness by installing the air dryers. I'm personally not a fan. What's your professional opinion?
Well, I personally am not a fan either, but it's debatable. Hand dryers are usually not used in hospitals, but you definitely want to be careful either way to not recontaminate your hands by touching the dryer or by, dirty paper towels. So sometimes you just have no choice.
There are in most of the large box stores, if you will, there's no paper towels. There's the blower machines that dry your hands. And I read a study not too long ago that those machines pull the air up from the floor, and that there was an issue with potential bacteria, whatever virus, whatever, getting into those machines. Is that valid? Have you ever heard that?
I've read some of those things as well. I think that's probably why we don't use them in a hospital setting.
It's just, and nowadays when, people, I think, are washing their hands more frequently when they're in a store. Many of the machines at the big stores that I've been in recently, don't have enough oomph to them. There's just not enough air coming out. Now, there's a brand of them, and I can't think of the name of them, that just blow out a hurricane, okay? I can think of a place that has them, Menards and several other places. So when you realize that you've got a machine that just is a soft wind machine, I think it takes a half an hour to dry your hands, and I know people aren't going to stand there and do it. So I'm kind of thinking you ought to carry a paper towel in your pocket or something. What do you think?
I think women are always good at carrying extra tissues and things like that in their pocketbook.
Okay.
What do we do to help our kids and children be more mindful about washing hands? Is there a way to make it fun by singing a song or some other level of engagement you might recommend?
Sure. I always encourage my granddaughter to sing Happy Birthday. That's one of the popular options. But, ABCs or whatever. Young children especially enjoy washing their hands when they're doing that. And it builds good habits.
Okay. Speaking of other good habits, I want to mention, before we get too much farther in the program, that there's still time to get your flu vaccine. So if you haven't been mindful about getting vaccinated for the flu, we know that coronavirus is on everybody's mind, and hand washing certainly contributes to healthy activities, whether it be flu or coronavirus. But don't be afraid to stop by the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We have both regular quadrivalent vaccine and the high-dose vaccine for senior citizens. So you can stop in or make an appointment on our website, and we can certainly take care of you and bill your insurance. And most often, it's no cost to you out of your pocket. I noticed the last time I was in the hospital,
that the nurses, when they come into your room, they wash their hands and they also use hand sanitizer. And when they leave the room, they do the same thing. Is that really necessary that they use both, types of cleaning your hands?
Well, at Mercy in the hospital setting here, we actually use antibacterial soaps in our dispensers. So, no, it's not necessary. I think a lot of people, it just makes them feel more comfortable to do that. The only caveat about that, and Kathy kind of touched on it earlier, is that you have to be careful, if you're using soap and water hand wash and then you're using an alcohol-based sanitizer on top of that, and you're doing it frequently, especially as we are in the hospital setting, your hands can tend to get dried out and chapped more often, and that's an important part of hand hygiene, is making sure that your skin is maintained.
Right. Okay, so your hands are really dirty, okay. Does the hand sanitizer alone suffice as opposed to soap and water?
So the hand sanitizer is really good at disinfecting, and as I said, alcohol, so it's really it's an effective disinfectant. However, it's not very good at cleaning. So if you have visible dirt or soil on your hands, or if you've touched body fluids after using the restroom or whatever, soap and water is definitely preferred. It's better at cleaning. And then, as I said, the sanitizer is an effective disinfectant, especially if soap and water is not available.
Okay. So we don't, to reverse this, we don't need to use soap and water on our hands after we hand sanitizer, or is that better?
If you're going to use both, the process would be to use soap and water to wash your hands and then use sanitizer to disinfect. If you use soap and water after you've disinfected with the sanitizer, all you're doing is washing that off, if that makes sense.
Sure, I understand. But we've recently got in some hand sanitizers that have aloe vera in them, and I guess I haven't tried any of them, but do you think the aloe vera in those products will help from, let's just say, for conversational purposes, overuse of hand sanitizer on the skin?
Absolutely. A lot of the more popular hand sanitizers will include some kind of an emollient like aloe vera or what have you that helps protect the skin. And it makes it more comfortable to use.
It is overwhelming, the formulas that have come out for hand sanitizer, like, just plain flat isopropyl alcohol in some, and which is real liquid, which is kind of a pain. And, of course, the old Purell-type gels that everybody has copied. So I haven't seen anything else lately. Have you folks seen anything new, current, whatever, in the hospital environment?
Not necessarily new, but I think it's important. This is a good time to maybe remind people about handmade sanitizers and so forth. There have been some alcohols used that are not appropriate for hand sanitizing. You want to make sure it's a 60% or greater ethyl alcohol content. So just be mindful of, the handmade sanitizers and so forth.
Okay, I think we'll take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia. You know us. We're the Half Off on Hot Buy store in Louisville. Our Christmas treat to you is 50% off of our already half-off Christmas seasonal merchandise on Wednesday, Thursday, Friday, and Saturday. Our lighted Christmas pictures are a knockout, and we have a huge inventory. Don't miss this sale. The Half Off on Hot Buy store in Louisville next to the Medicine Center Pharmacy. See us on Facebook and check our website, halfoffhotbuy.com.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing proper hand-washing techniques with Tonia and Kathy from Mercy Medical Center.
All right, before we get back to the focusing on our hand washing today, I wanted to touch base and mention that, not only can you do good things to maintain good health in this environment with the pandemic, with washing your hands and making sure you have your flu shot, but you can also keep up on your nutrition. And, there's a number of things you could do nutritionally to support your body, from just a simple multivitamin to taking a vitamin C and some zinc and some vitamin D. And we even have some beta-glucan and some other immune-boosting products that you can consult with our pharmacists at the Medicine Center, and we'd be happy to make a recommendation based on your situation. But don't overlook the fact that there's a lot of things you can do to help support your immune system. And a lot of your immune system is through your GI tract and your gut, and proper nutrition is a big thing. So make sure that you're mindful and wash your hands. Make sure you get your flu shot, but also make sure that you're paying attention to those extra nutritional support tools that you can use to maintain good health. So with that, we want to get back to talking about how important National Handwashing Week is, and it's important every week during a pandemic. So let's talk about just our daily activities. When should we wash our hands during the day? And is there a recommended number of times a day that we should think about washing our hands?
Well, there's not necessarily a recommended number of times. It's just important to do it at the appropriate times. So, for example, like before you prepare food, after you've prepared food, also while you're preparing food. So if you're moving from preparing meat to preparing vegetables, you should wash your hands in between there to avoid contamination, cross-contamination. If you're taking care of somebody at home that's sick, obviously if you yourself are sick, if you're obviously after using the bathroom, but don't overlook if you're helping like a small child with the bathroom, you need to wash your hands. Obviously, if you have pets, if you're petting your pet or feeding them, handling their food, cleaning up after them, you should wash your hands. And then taking out the trash, you should wash your hands.
I think it's probably worth... Go ahead, I'm sorry.
That's all right. Anytime you're touching something that, as Kathy said earlier, is soiled, then you need to wash your hands.
And actually, that's exactly what my thought was taking me to. You know, the frequently touched surfaces, we work really hard in the pharmacy to wipe down things that people touch, and I think it's made us all a lot more mindful of what you touch during the day. Right. Door handles, right. You know, sig pads for what you sign for your credit card and stuff. I mean, all those little things, you just don't really, I think we took it for granted for a long time. So I think it's something that's important to keep top of mind. And this is a pet peeve of mine, but, you know, if you have an ice maker in your house, don't reach in and pull ice out of your ice bucket without washing your hands. I mean, just simple little things that can avoid spreading things without bad habits. So you mentioned earlier, before our commercial break, about antibacterial soap. I know there's been some debate about antibacterial soap versus regular soap. Can you comment on that? Is one better over the other? What happens in the hospital, and what do you recommend for patients at home? So,
yes, as I said, in the hospital and here at Mercy, we use an antibacterial soap in our dispensers. And the reason for that is at the hospital, we take care of sick people, and a lot of times sick people have bugs that are really resistant to antibiotics and so forth. So that is why we use an antibacterial soap. However, at home, you don't necessarily need to do that. Plain soap, you know, is perfectly adequate. It's all that's recommended. There's some studies out there that suggest that possibly the use or overuse of antibacterial soaps, for example, in the home settings, may contribute to antibiotic resistance. So, I mean, there's nothing that I know of that's out there, you know, black and white that says that is the case, but there are some studies that suggest that. So, in the home setting, plain soap and water is perfectly fine.
Any different hand hygiene techniques that we should consider when we're in a public restroom versus a home? Or is the exact same process for consistency the best practice?
Not really. I think you should do the same process that you do, you know, at home, also out in public. Obviously, turning off the taps with your paper towel. Maybe you don't do that at home, but you know, we don't have it's just my husband and I, so we don't have, you know, a lot of germs floating around here that you would out in public. But basically, you use the same technique, the same steps.
I've noticed, at least in some public restrooms, that in the past there haven't always been trash cans by the door when you have to physically grab a handle to open a door to walk out. But now it seems like, much like you mentioned, using a paper towel to turn off the handle for the faucet, even myself, I feel comfortable using a paper towel to use the door handle to walk out of the restroom. So it's nice when they have a trash can there so that it keeps the room clean. But, you know, don't overlook those things. I mean, simple things you can do to protect yourself from other people who might have been careless.
Absolutely.
Hey, guess what? It's the bottom of the hour, and it's time for the news. Thanks for joining us on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
A virtual visit with Santa right in your own living room.
Log on to WHBC.com and share your children's Christmas list with Santa, and you could win a virtual visit with the big man himself.
Wrapped up by Hartville Hardware and Lumber, Hartville Kitchen, T-Mobile, Friends and Family Credit Union, and News Talk 1480 WHBC.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
It's a winter wonderland at Studio Arts and Glass. Our annual holiday open house now through Thanksgiving. Take 20% off your entire order. Hand-blown glass ornaments, your Santas, jewelry, come make a wreath or a glass snowflake. 20% off your entire order. See our extended holiday hours at studioartsandglass.com. Shop local this holiday season.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing the benefits of hand hygiene with Tonia Burley and Kathy Reed, both registered nurses from Mercy Medical Center.
We know we should wash our hands thoroughly before and after preparing meals. However, what's the best way to clean and sanitize our kitchen surfaces before and after meal preparation?
Any household disinfectant that you buy in the store is adequate. It's just important that you make sure you have a clean surface to begin. And again, as I touched on earlier, if you're transitioning from, say meat to vegetables, you either use like a separate cutting board, for example, for each, or that you disinfect it adequately between so that you avoid that possible cross-contamination.
A little bit off the subject, but maybe not. I was in a pretty well-known takeout restaurant here in town several days ago, and I noticed they weren't wearing gloves. And they would get off the phone, lay the phone down, and pick up the cheese. So without gloves, where are we on there? Is there some inspection thing at this time now, even tighter for restaurants? Do you know? Or
inspections are done by health departments, and
sure.
Every area has a different health department, and of course we're all challenged during this pandemic with lots and lots of issues. But you're exactly right. That's a pet peeve of mine. You go to eat and someone is using the cash register or talking on the phone, and they turn around and handle your food with their bare hands, and they haven't cleaned their hands. And
that really bothered me, and I'm not going back there. So
right.
It's kind of too bad because the way things are right now with everybody gloved and everybody masked and everybody hand sanitizer and soap and water and all that stuff. I just looked at it and I thought, what are you guys up to?
Well, it can be an issue too, though. Sometimes gloves can become a crutch. So if someone puts gloves on and then they touch your cheese and then they touch the phone and the cash, and then they go back to it's the same issue, So gloves aren't necessarily the total solution. It goes back to hand washing.
I think it's kind of amusing. You see a lot of people driving around with gloves on,
Right.
So,
exactly.
And I'm thinking, oh, wait a minute. Why are you doing that?
Exactly.
But anyway.
All you're doing is contaminating everything that you touch.
Exactly. And the car, and particularly the car, of course, So.
Right.
All right. So meal preparation, we just kind of kicked that around, I guess. What about, many years ago, and they're probably still out there, but there's a lot of home kitchens that have butcher block centers in their kitchens that they cut meat up on and all that other kind of stuff. And, how do we properly clean those?
That's a little bit debatable too. Wood is porous, and especially if it's not sealed, so it can be difficult to disinfect and so forth. But so a lot of times a solid surface is preferable. But we're not going to tell people to throw out their butcher block islands or whatever. I think it's just more important to be cognizant and to disinfect frequently and appropriately.
So, okay. What about handling raw foods, which is sort of there? How do you sanitize your hands in this scenario?
So, again, going back to
here you are making a hamburg patty, and all that kind of stuff,
so soap and water is appropriate for that. Because you're handling that raw meat, and the sanitizer again does not kill all of the germs that soap and water does, and so soap and water is appropriate in that circumstance.
So some people also use paper towels, turn off the water faucet after washing their hands, and open the door to a public restroom. And it bothers me when I know everybody has seen that scenario go on happening in the restrooms, public restrooms, signs everywhere. Employees must wash their hands, all that sort of thing. What do you do? Turn them into the manager if you see it?
I use my, a lot of times I'll use the sleeve of my jacket. Because a lot of times, Brad kind of touched on this earlier, the placement's not right, to be convenient to open the door or turn off a faucet. So I'll use the sleeve of my jacket.
Yeah, it makes sense. You got at least you're drying, and kids are an issue. Kids are an issue
I use the sleeve of my jacket to turn off or to open the door,
or the doorknob, or the doorknob or whatever.
Right.
Sure, I've done that too. So. Kids are kind of a real, it's kind of like brushing their teeth, okay? Did you brush your teeth? Okay, did you wash your hands? What's the deal with kids, Do you think the average child has been, this isn't the right word, but has been frightened enough about the virus and, this and that and all that stuff?
Well, somebody touched on it earlier. I think it was Brad. I think that availability of supplies and things that are attractive to a child, making it fun, and then very importantly, I think it's you need to model the appropriate behavior. They see you do it, then they do it. They get into the habit of doing it. Same way with wearing your seatbelt or anything else. Modeling for children, I think, is very important.
All right, so in the workplace, we're kind of, we've talked about the hospital workplace. I haven't really talked about the pharmacy workplace, but we can talk about the pharmacy workplace real quick here. Like any responsible business, we are trying to make sure that we minimize the cross-contamination of any germs between our staff and our patients and patrons. Hourly we wipe down, or more frequently, the frequently touched surfaces, whether it be doorknobs and credit card pads and cash register keyboards and counters and things of that nature. And I think it's been a real interesting lesson in how we evaluate our environment. We've always been very intentional in the pharmacy during cold and flu season for the same reasons as we are now in the coronavirus pandemic, but now maybe it's certainly been magnified. What have you found to be effective to educate coworkers and friends? I'm sure Mercy has a very robust training program, and I bet we can all learn from some of your really good habits that you've put in place at the hospital.
Sure. We have a lot of signage out that's visible, reminds people to wash, obviously above sinks and in bathrooms, like the signage you see in the restrooms reminding workers to wash before they return to work. We pass out hand sanitizers. We have continuous reinforcement. Try to mimic good behaviors. So if everybody's doing the right thing, it kind of catches on and everybody, learns from that. And we give our workers permission to remind each other that, it's okay to remind each other, hey, I see you forgot to wash your hands, please wash, or something like that. And, also comes with that, you have to be accepting of that and say, oh, I forgot, and, you go do it, and there's nothing said about it. So just lots of different things, but I think it's a continuous reinforcement process.
We actually also have, we do observations of our hand hygiene in the hospitals in different areas, and then we give the feedback to the staff. This is what your percentage of appropriate hand hygiene was this month, so that workers know, how well they are not doing, and they can be held accountable, for that.
In this virus atmosphere, I'm told that the virus lives on inanimate surfaces. What are the most common surfaces that we really need to pay attention to and clean, fairly regularly?
Well, like Brad was talking about, the frequently touched surfaces, your doorknobs, your phones, your light switches, things like that. The hard surfaces. Organisms, germs don't generally live very long on like cloth and paper and things like that. But your hard surfaces, your computer keyboard, your phone, light switches, that kind of thing.
I guess, does the virus need a wet surface to reside on if it's on a hard surface or not? Or don't we know?
I think those kinds of studies are still being done. I think it can. Germs tend to do better in a wet environment. However, I would not say that because something is dried that that it's not still capable of causing infection. I wouldn't say that at all.
Okay, we'll take our last break here. You're listening to Health Matters with the Medicine Center Pharmacy.
We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. You know us. We're the Half Off and Hot Buy store in Louisville. Our Christmas treat to you is 50% off of our already half-off Christmas seasonal merchandise on Wednesday, Thursday, Friday, and Saturday. Our lighted Christmas pictures are a knockout, and we have a huge inventory. Don't miss this sale. The Half Off and Hot Buy store in Louisville next to the Medicine Center Pharmacy. See us on Facebook and check our website, halfoffhotbuy.com. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked.
Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White, and thanks for joining us today. So let's get back to the final segment of the show about educational materials for our families, classrooms, or workplaces. Do you know where we can get some literature on this?
Sure. At the beginning of the show, I talked about Henry DeHaan. That is a great website for children materials for children in classrooms. They have games, puzzles, and so forth. The CDC site has great posters, also activities you can do, quizzes, and things like that. Those are a couple sites that are really good.
All right. What specific types of germs and illnesses can be spread if we don't wash our hands properly?
That would be common illnesses like all the different cold viruses, flu viruses. There's a lot of different viruses that cause diarrhea, and all of those could be stopped or at least decreased with good hand hygiene.
I know in healthcare we like our statistics. Do you have any statistics you can share about hand washing?
I absolutely do. The CDC says about 80% of infections that are transmitted between people are spread by contact. So hand washing can reduce that greatly. Proper hand washing can reduce school absenteeism by over 50%. Hand hygiene, done properly, can reduce diarrheal illnesses by about 40%. And can reduce pneumonia by almost 20%. And finally, only about 19% of us wash our hands appropriately.
Wow.
That's crazy, isn't it?
Sure is.
Well, I guess we all have work to do. So.
Yes, we do.
Well, it makes me think about one of the challenging things is when you're out and about, and, this time of year is probably one of the more challenging, and, people are used to their Black Friday shopping and maybe Cyber Monday shopping and those things and being out and about in the community. And when you're out and about in the community, it's going to make it even harder to be mindful about keeping track of what you touch. And it only takes one touch to that door handle or that counter, and then you rub your eye or touch your face or something, and bam, you've made contact with something that maybe you don't want to. What can you recommend for listeners to be mindful when they're shopping in the community and maybe they're not beside a bathroom to wash their hands right away?
Right. You touched on it exactly. Mindfulness and awareness of what you're touching. And one of the biggest things is your face. People are wearing their mask, but they're reaching up to adjust their mask. They're scratching their nose. They're wiping their eyes and contaminating themselves all the time. Obviously, you want to stop doing that. Wash before eating when you're out, and wash after you use the restroom. A lot of people carry mini hand sanitizers so that they've always got something there in case there isn't a restroom close by. So that's always good to have.
Well, we're getting close on time. Do you have any recommendations to share or final words of wisdom to share with the listeners that you'd like to make sure that keeps everybody happy, healthy, and safe for the holiday season?
Absolutely. Mask up, wash up, and back up to protect those around you. Avoid these large holiday gatherings and make sure you get your flu vaccine.
We haven't heard much about the common cold or the flu this winter. It's all been clouded with with the virus. Is there much going on? Congestion, things like that. Are you guys seeing that?
Well, we're actually seeing an early start to the flu season. Typically, flu in this area has started around this time, but we actually started seeing flu, a month or a couple months ago. So it's actually a little bit early for flu, which is concerning. Again, another reason you need to get a flu vaccine if you haven't.
It's interesting. There's just not a mention on the news. It's all about corona and all about the virus and all the issues around the country and stuff like that. But I don't think I've heard any mention about the flu issues this year. So are we going to get hit hard with it, or don't you have a prediction there?
I don't know that I've actually heard or read about the prediction for this year, but all I can say is, flu is always out there. It started early this season. You definitely don't want to get a co-infection, to have the flu vaccine and COVID at the same time. And the flu actually is a vaccine-preventable disease. So we have a vaccine available to prevent you from getting the flu. So, again, if you haven't gotten a flu vaccine, please get one.
We do have flu vaccine available at the medicine centers, so you can stop in any time. We'll be happy to take care of you. We can bill your insurance. It's no hassle. So that's really good advice.
Tonia Burley, registered nurse, infection prevention and control coordinator, and Kathy Reed, registered nurse. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to our Mercy Medical Center, Studio Arts and Glass sponsors, and of course our technical producer, J.D. DeAngelis. As always, we thank you listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.
Normally, getting the family to Santa is a chore. Getting dressed up, loading up the car, and waiting in line.
Great, I'm stuck behind the Golden Girls.
On top of everything else 2020 has thrown at you,
Coronavirus!
Why add to the hassle? That's why we're making it easy and bringing Santa to you. That's right, a virtual visit with Santa right in your own living room. After all, you've been socially distancing, wearing your mask, and taking care of others all year.
Are you on the good list or the naughty list?
You've definitely made it to the nice list.
Log on to WHBC.com and share your children's Christmas list with Santa, and you could win a virtual visit with the big man himself.
Merry Christmas.
Wrapped up by Hartville Hardware and Lumber, Hartville Kitchen, T-Mobile, Friends and Family Credit Union, and News Talk 1480 WHBC.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.